McMullen. I'm a psychiatrist. I went to Georgetown Medical School, and then I went to Columbia Presbyterian for my residency in psychiatry. And for over 35 years, I've specialized in evaluating patients for treatment with medication, and also what type of psychotherapy might be helpful to them also. And I've also used a lot of nutritional supplements that have proof of working to treat depressions and anxiety. And in the last 9 years, we've been using TMS, Transcranial Magnetic Stimulation, these giant magnets that put pulses of a magnetic field into certain areas of your brain, and these have been shown to significantly help depression, anxiety, and even Parkinson's disorder and chronic pain syndromes. And they have very little to no side effects. Now, with regard to alcohol, this is a big problem. Alcoholism is a huge drag in our economy, but it's also bad for the brain. And it's difficult to say exactly why alcohol makes people have more depression. Some people call it a central nervous system depressant, but that means something different than causing depression. It just means that something depresses the central nervous system, meaning it tamps down the central nervous system, the brain, and if you tamp it down enough, you'll stop breathing. There's dozens of young people on college campuses who die of alcohol poisoning every year. If you drink one hard drink after another, in half an hour or so, you're going to be very groggy, and you are going to fall asleep or maybe lose consciousness, and then you'll no doubt survive it. But if you were to take a bottle of bourbon, which many people have done, and instead swig it like you're drinking Pepsi-Cola, and just chug it down and try to drink half a bottle at a time or the whole bottle, you're very likely to die within 10 minutes, because the CNS depressant effect of the alcohol is going to be so strong, because you're going to get enough alcohol in there that it'll stop you from breathing. Under normal circumstances, since we're sitting there having one drink after another, we don't reach that point because we fall asleep before we reach the point that we can't breathe. However, with these drinking contests that happen on college campuses, there's a huge risk of people dying. And I've had a couple of patients who had relatives who died this way. Another thing that happens with alcohol is it affects everything in the brain. With a medication like Prozac or other antidepressants, sometimes you're just affecting one receptor, and you're just blocking the reuptake of serotonin at one receptor. Now, this may have a few other effects as a cascade event, but you're basically doing one thing. But with alcohol, alcohol permeates everything. It goes into the whole cell. It affects the whole cell's functioning, as well as affecting a lot of receptors. There's such a multitude of things that it is doing, it is difficult to say why it is causing any particular problem. It causes cirrhosis of the liver, in part because it kills off some cells, and in part because it makes the liver turn into a fatty liver and becoming all fat cells to the exclusion of normal liver cells. And the effects on the brain are much more complicated than that. But in any case, it seems to increase the risk of people having depressions. People that drink a lot seem to have more depressions, and people who are bipolar, who are to a small degree or a big degree manic depressive, where they have highs and they get very animated and spend a little extra money and do a few risky things, do a little too much gambling, do a little too much inappropriate socializing. Those people end up having a worse mood disorder if they're also heavy drinkers. And so in general, it's better to avoid alcohol entirely, or at least to minimize it a lot.
Thank you very much, Doctor.